Brown Chicks, changing the face of therapy on both sides of the couch.
Yes. Right? We appreciate you for joining us for session 19, 18?
19. Yes.
I put 18 on my Facebook. This is session 19.
It's all good.
And we have Miss Kamilah.
Hello.
Thomas.
Hello.
Mimi is what you told me to call you when I first met you. I don't know.
Yes, that's fine. I go by Mimi too. That works.
And today we're going to talk about microaggressions.
Yes.
Which we've discussed like briefly in other interviews, but we've never like really went in depth about it. Mm-hmm. And this is something that it seems like you have a lot of interest in.
Yes.
And so we are going to ask you lots of questions about microaggressions, and then we're also going to learn more about your practice and what you have going on within the therapy community.
All right.
All right.
Yes.
Anything else going? Oh, still not minority mental health month. Mental health awareness.
Yes.
Month. If you go to melaninmentalhealth.com, the shop.melaninmentalhealth.com, you can get a percentage off of your shirts if you use the code mental health. So go check out our shirts. Nobody has on a shirt today. We don't
but I have my mug.
But the mug is on there.
It's sexy.
The mug is on there. You can get a discount on that. The self-care is sexy shirts. All of that. So go check it out. Thank you guys for supporting us. That's our little commercial break in the beginning. Since we don't have any sponsors yet, we'll just do our own commercials.
Yes.
All right. So we are going to get started just directly talking about microaggressions and kind of clarifying for the sake of this conversation what exactly are microaggressions.
Yes. So microaggressions are going to be the brief, everyday situations that can be either verbal, behavioral, or environmental that send a message that can be negative or hostile, derogatory in nature that's directed towards a particular person or group based off of 4 things. So sexual orientation, gender, race, or religion.
Okay.
Yes.
That is a great definition.
So it's a long definition, but there are 3 different types. So hopefully that will kind of clarify exactly what that looks like.
Okay.
So keep in mind with racial microaggressions, this has been studied by Professor Daryl Sue Wing, who is a professor and researcher at Columbia University. So he's done lots and lots of studies about racial microaggressions, and he's Asian American.
Okay.
Yeah. So when we talk about the 3 different types of microaggressions, I'll start with the most aggressive, which is going to be a micro assault. So this is going to be the blatant, explicit, like in-your-face racism, the old-fashioned racism that we're used to thinking about, where there is no doubt that this person intended to hurt someone. So this would be if someone is saying a racial slur, if they're displaying swastikas, burning crosses, those are micro assaults.
And that's so interesting. You know, you said sort of this old-fashioned, and I feel like the retro is coming back these days. This retro sort of, it's very much in our face.
It is
these days.
So with micro assaults, typically people would either engage in those in private with other people who had the same similar thoughts and beliefs. So we think about the private KKK meetings, right? So they gather in private, but also it can be seen publicly. One, if a person just totally loses control, and they're just like, I don't know what else to say to hurt you, but like a racial slur. So think about if you're getting into an argument or maybe like road rage and someone just like calls you the N-word, right? Or if we think about the riot in Charlottesville, Virginia, when it was public but it was group, so they felt very comfortable to do that in that type of setting.
Okay.
That makes sense.
Okay.
Yeah.
That's interesting though. I would have never thought micro assault would be in the category of microaggressions, because I've always thought of microaggressions being more like subtle, and like you said, that's very direct.
So those are the other 2 types, the subtle unconscious ones. So we have micro assault, which is very blatant and explicit. Then you have what's called a micro insult. So this is going to be the subtle little messages where it's rudeness, you may feel ignored, where it makes the person question, did this really happen? Am I tripping? Maybe there could be some other reason for why this person said or did what they did. So an example would be, let's say you started a new job and you're on a break for new employee orientation and everyone is sitting around like, oh, well, this is my previous work experience, this is my degree, and then someone turns to a person of color and says, so how'd you get this job? So, you know, the underlying message
Right.
is you didn't get this job because you have the abilities and the skill set like the rest of us. It must be because of affirmative action or nepotism
Right.
or something else.
Okay.
Or let's say there's a student in the class. The student is a person of color, and the teacher is Caucasian. And so the student is sitting here raising their hand to answer a question, and the teacher's kind of looking around, ignoring this student and waiting on, you know, another student who may be Caucasian to, you know, to call on. So again, this teacher hasn't said anything, but it's that nonverbal message of, I'm not going to acknowledge your presence. I don't want to call on you. I'm going to wait for something else.
Okay. So that's the micro insult?
Micro insult.
Okay.
Yes. And a lot of times these type of things occur subconsciously or unconsciously for the person who's engaging in that type of microaggression.
Right. So they don't recognize that they're doing
They
it.
don't. Right.
Okay. Okay. So that goes a lot into what you said about like schools. I always my friend's a teacher and she talks a lot about like minority boys and how they're treated in schools from black, white, whatever teachers, they're treated a certain way.
Right.
And so that sounds like that would be an example of that, where it's not necessarily a conscious thing, but they are unconsciously treating these children different than they would other children.
Absolutely.
Okay.
Absolutely.
So help me then, because the micro assaults, then you said it might be directed at, you know, maybe somebody uses a racial slur. So is it micro because it's at the point of rage that they use it? Because it feels very macro.
It does feel very macro. So again, these categories are how Dr. Sue kind of categorized them, and then he broke them down even further into 9 very specific ones, so like color blindness and things like that.
Got it.
Yeah.
Okay.
But so micro assault is, yes, that is very macro.
Right.
Yeah, that's very
There's
assault.
nothing- I don't need to think about it.
Like
I know what it is.
Yeah.
I know what this meant.
That's like, this is very clear assault. Like,
Yes.
you're in my face.
Yes.
Right?
It is very in your
Okay,
face.
okay.
And this is going to be something that's conscious, right?
Right.
So this person knows exactly what it is that they're
Right,
doing.
right.
Where the micro insult can be unconscious, and the third one, which is micro invalidation, can also be unconscious as well.
Ooh,
Okay.
tell us more about that one.
Yes. So the micro.
I don't see color.
Well, almost. So the micro invalidation is going to be when a person of color's thoughts, feelings, or experiences are not validated. They're told to get over it. You're being too sensitive. This didn't really happen, type of thing. So, at least I remember one of the podcasts you mentioned. I think you were at work somewhere and someone mistook you for like
cleaning
janitorial.
lady. Yeah.
Right, the cleaning,
Okay,
like the janitorial staff. So let's say you were sharing that experience with one of your Caucasian friends, and they're like, girl, you tripping, that didn't really happen, or I mean, well, what did you have on?
Right,
They're
right,
invalidating
right,
your experience, but you know, you may have had other experiences similar to that, and they're just like, no, that didn't happen.
Maybe you're being a little sensitive.
Right.
Like,
It wasn't that big of a deal.
maybe she just, you know, she said she was sorry.
Right. Right.
Right.
And
That could have happened to anybody.
Right. And you're like,
It's not about race.
when's the last time it happened to you?
That's like the my friend just posted. So me and my friends go on vacations. I mean, like local drive out somewhere and get an Airbnb every summer. And so they just posted about this group of black 30-something adults that have rented out an Airbnb and were leaving with their suitcases, and the neighbor called the police on them to say like they thought they were stealing stuff from the house.
Yeah.
So
we went in and packed.
right, like we packed suitcases
Why did I
steal
have
from this
suitcase?
house.
Right.
And so the police, 9 cars, a helicopter.
Oh my God.
But the police were professional. They handled everything great.
Right. They're
Whatever.
taking precautions.
But that's one of those things where when I was reading the comments, which I don't even know why I do this to myself. I try not to. Normally I don't. But I read some of the comments and people were like, you know, this sucks. As far as like we can't do things that white people do without being seen as a criminal, blah, blah. And of course, other comments are like, well, it's not about race. I teach my kids not to see race. When you keep talking about it, that causes the problem.
The colorblindness.
That's which is a micro insult.
Yes.
Okay. But even the people that were like, they're making it into something that it's not. Like it's not because it was a whole thing.
Yeah.
But basically they were kind of invalidating the fact that this is an experience that a lot of minorities have had.
Right.
Maybe not so blatant as that. Well, a lot of times it is as blatant as that, right? A lot of times you are being followed around a store,
right,
very clearly because, I don't know.
Right.
I can't figure out why, but so it is that blatant.
So these things come from people's, biases and stereotypes, sometimes social conditioning, or things that they may have even been taught.
Yeah.
Right? And so that's why it's unconscious, because they don't really think about it. Oh, I'm being prejudiced, I'm being racial. It's just things that they're used to doing. So, you know, I've had an experience where I was working at a place that will remain nameless, and
Nameless LLC.
Nobody put nobody on blast.
Right, exactly.
But a little Caucasian boy, he was between the ages of 4 and 6. I'm sitting there making coffee, waiting to see clients, and he comes out, looks at me, and says to his mom, "Mommy, what's she doing here?" And so I looked, and I'm like, he's a kid, let me just wave. Then he looks again and says, "No, she's a bad person."
Ooh.
And I just, you know, my feelings were hurt. I looked at the mom like, hello, this is a teachable moment. What are you going to say? She didn't say anything. She looked at me, grabbed her stuff, and left.
Wow.
And so in that moment, I'm questioning, well, what is it about me? You know, I'm just coming into work, sitting here making my coffee. What is it about me? Why would this little boy look at me and ask me, one, what am I doing here? And then that I'm a bad person.
Right.
Right? And so I wasn't upset at him, because I feel like at that young of an age, this is something that he's been taught or heard.
Sure, yeah.
But for that parent, I was like, wow, there was something where clearly she was uncomfortable. I don't know what you're teaching your son. But in that moment, I couldn't be in my feelings, because I have clients to see who look like this little boy. And so I have to stuff all this down. I can't really process it because I don't have time right now.
Right.
So I'm not carrying any of that when I'm seeing other clients that look like him.
Well, and I think that speaks to what people of color have to also deal with on a daily basis. Like, on top of me just the stressors of a job, and then I'm over here making coffee, right? And then I as a therapist, I have to be present for my clients.
Right.
I have to deal with these moments where, just as a human, and my human experience, right? Like how I'm invalidated, and it's so it's like, wow, like I'm just making coffee,
right?
And then you really don't expect it because it's a child,
right?
Right. And so I think that is such a good example of how you then do become kind of like, okay, like where's it gonna come from next? Yeah.
I think, and also it's one of those things where when people say like you're making a big deal out of it, or if you don't talk about race, it won't be a thing. But not giving that benefit of the doubt, or just believing people that we typically go through life with other people reminding us that we're black. You know, or that we're Hispanic. It's not necessarily that I'm sitting around talking about, oh, look at me, I'm black. It's like when I have an experience, it's like, oh, shoot, yep.
Well, and I think it's that, it's that underlying, like, that it's there, because, you know, I'm in a parking lot one day. You know, somebody's honking at me. I wasn't quite as therapish at the time.
Got it.
And so the woman's like honking at me. It was a young white lady, probably like college age. And so I'm just there like, okay, we're having a disagreement about parking spaces, right? Like she's like, I'm like, I'm going.
Right.
Right? Like I'm going. And so she starts, you know, blah, 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 blah back, and not cursing, nothing. I'm just like, I'm getting ready to go. And then all of a sudden she just calls me the N-word.
Wow.
She looks at me and she's like,
so that was a micro assault.
And I was so like, I'm parking. You know, like, so it's that quickness of like, wow, like that's where it jumps to. Like, you're not even calling me a B. I'm not even, we're not even.
But if they say B, they say black B, because that's happened to me. And I'm like, whoa, I couldn't even just be a B. I was a special kind. I could just be a regular.
Right. And so it was like,
yeah.
And then she, and what really got me, kind of like how you're saying about, was her face. She like smiled.
Because she knew that was the worst thing that she could say.
And drove away. And I was like, wow. And you're like 20-something, cute little college girl.
Oh, that don't mean anything. But this is what I mean by the micro assault. It happens when she felt out of control. You're having this back and forth. There's nothing else I can say. Apparently, you were not moving fast enough. Right. She was not going to stay.
She
so
needed to get her chicken shawarma fast.
was so
she
important.
was hungry.
It was
lunchtime.
so important.
Well,
You know? And I was like, so, but yes. Now I gotta like collect myself, and on top of just the annoyance, now I'm like, wow, that just happened.
Yeah. And then you have to get yourself together.
Yeah.
And she just drove off like,
She was like, and the smugness in her face was what got me like, wow.
right.
Look, come back here, come back. No, at that point, it's like, those are the moments that you're then just like, now I have to drive away, collect myself, ground myself, and
use your crystals.
use
your crystals.
Get my sage.
Get all that energy away.
Yes.
So what I feel like those are stories of like when you were clear that someone felt a certain type of way. What are some examples, or how do you know if you have been a victim of microaggression that isn't a micro assault?
Right. So there's 3 indicators that a microaggression could have occurred. One is if it's subtle and likely unintentional, right? So again, because it's not macro, right? So this is it causes you to think what actually just happened. The other thing is if the person, especially if they're a Caucasian or white, when they disregard any differences. So if they say, well, I don't see color, you're just a woman, all people are the same, right? They're disregarding their differences. There's no way someone could look at me standing next to a Caucasian person and be like, I just see 2 women.
Right.
Hello, hair,
complexion,
my
all this
t-shirt,
melanin,
all of this. Right, there are differences, right?
Right.
You can still treat us the same, but to totally ignore the differences,
Okay.
right? And then the third would be if the situation occurs and it's possible that there could be other reasons for why this person said or did what they did. So I actually experienced this. I went on vacation to Belize. We had to take a little hopper flight. And so we're all getting on this little tiny plane. I'm seated, 2 African American women come in and they go to the front because we can sit wherever we want to. And then it was a couple, man and woman who were Caucasian, came in afterwards. They sat down and the flight attendant asked the 2 black women to move to the back. And so I'm sitting here like, oh,
wow.
Shit, here we go, right? And so one of the
I'm trying to think of a possible reason.
I'm gonna tell you.
Okay, go ahead.
So one of the black girls was like, no, I'm not moving to the back. And so the lady says, well, I'm just trying to, with the weight difference, just kind of move you guys around. That's what she said.
I'm taking the plane out by sitting in front of it. Like, really?
When she said it was weight, right? And so she was trying to shift. And so the woman said, okay, well then this couple came in after me. Why wouldn't you tell one of them to move to the back or wherever they needed to be? And so it became a whole thing, and I'm just sitting here like, we ain't have enough room in this tiny plane to be in here fighting. I need to make it back.
I'm just trying to have a good run.
What's really going on. And so everyone just felt a little tense. And so one of the white woman was like, just fine, I'll just go to the back. And then, that was that. Right. But, for that flight attendant, her reason was, I'm just trying to make sure that the weight on the plane is spread even because I'm not trying to fly out the sky.
Right.
Yeah. But I think it was how she asked. So if you needed to do that, as people are coming on, then maybe say, hey, can you sit here, sit there? Don't tell us you can sit wherever. Right. Yeah. You can do it that way. Right. So that's what I mean. It occurred, but there was another possible reason for why she told them to move. So, but we know for black people, our history is we got to go to the back of the bus. So I'm not trying to go to the back of anywhere.
Right.
Well, and I think you can't have that conversation about those types of microaggressions without including privilege as part of that conversation, to where you're so oblivious to why this might
be offensive to ask a black person to move to the back of any vehicle.
Right. Or the person that kind of got up like in a huff, right? Like, you're so oblivious possibly as to why. Or that whole, you're being too sensitive, you're making something out of it that it's not, know?
And not recognizing that you probably have had to make way less accommodations than black people have in certain situations. But because she's just asking, why is it that big of a deal?
Right.
As opposed to like understanding like, okay, this is probably something that happens regularly.
And I do think that, you know, that conversation about privilege also is, it's not that by acknowledging your privilege that's it's not your fault either, right? Like privilege is not about blaming somebody, but it's about recognizing how you might have more advantages than somebody else.
Right.
And it's so real, you know, and I don't know. It makes me think of, like, we had this one white friend, this one white guy, that whenever we would go with him to restaurants, or like, it's like we get in a whole different level. Like, we've gone to like a franchise Mexican restaurant, you know, where you get your happy birthday sung. We've been there for years, right? Years. And every time you go, they bring you the hat, they sing happy birthday, right? And this time we went with him and he got to keep the hat. And we were like, wait, how do you get to walk out with the hat? Right? And it wasn't just those, it was like all these, so.
And then it's frustrating because that's like an example, right? So it's like a small example. And so it feels like so petty. But then it's like, but when you have a life of
a
it.
collective of it.
That's what it is.
Yeah.
It's like you go to the bar and you open a tab with him, he don't gotta leave his credit card. Wait, what do you mean you didn't have to leave your credit card? They just opened the tab. No, I got, that's a thing. Like, so,
or even just letting you in the bars in Midtown. I used to go out a lot in Midtown, and guys in there with flip-flop shorts, tank tops. Another guy, different racial denomination, has on jeans, a button down, and his pants are cuffed. Oh, your pants too bad, you can't come in. Right. So it's like it's always those like small things that you just see in all these different places. And of course you could always give 30 other reasons why. But usually the common denominator is race. So
but there's other incidents. So if someone keeps asking someone who is a person of color, oh, where are you from? And they're like, I'm from Houston, I'm from Atlanta, I'm from Charlotte, I'm from Wyoming. No, you know what I mean.
Yeah, you really
where are you from? I'm from whatever, right? So what that person is really trying to ask is, what is your ethnicity, right? But the question, and again, that kind of breaks it down to, you're a second-class citizen. Or telling someone, a person of color, you speak so well, you're so articulate. Because you expected me to say what? Right. The ebonics, all of this. And so these are the other little things that can occur. So,
which is so funny, because I think people just have to make sense sometimes of, like, I have to make sense of this, right? Like, and so, you know, Ebony and I talk about that. I always get that, like, so what are you? Like, sometimes people just like straight up, what are you?
A human being.
And I'm like, oh, you know, or and then when I tell them, they're like, what? But, you know,
they don't necessarily believe you.
I would have never guessed you're Mexican. I'm like, I left my sarape and my sombrero at home. You know, I don't have my double braids on. Like, what do you think Mexicans look like?
But this comes from their own personal biases, their stereotypes based on what they have seen or heard. And so if you're in a community where everyone looks like you know, and your only experience with people of color is when their faces flash on the news, or like their mugshot, or the times where you have to work with them, it's very limited. And so it can be just that generalization, especially if you have a bad experience, and it's like, okay, I had this, so they're all like this, right? And so I've heard that before. Oh, you're not like the rest of them, and the rest of the black people are what? Excuse me, so it's they occur all the time, and I think over time it definitely can affect people's mental health,
100%,
because it affects self-esteem. It makes you have to continue to question, did this happen? Why did it happen? You know, sometimes we feel like, well, I try to speak as proper as I can, or do all the things that I can to make people feel comfortable and be non-threatening, when really we shouldn't even have to go through those things. I should just be able to wake up, walk out into the world being my authentic self. But unfortunately, unfortunately, that's just not the reality of people of color.
Right.
So over time, it definitely can cause lots of psychological, damage.
Absolutely, yes.
Yeah. That feeling of having to be one person in this environment, one person. What is that called? Code switching, where you have to be a different way in all these different environments. Because if I'm my natural self, you may see me as a threat, or see me as not as intelligent, or see me as whatever your thought process is when it comes to minorities.
Or just trying to feel connected to, we talk about this all the time in our field, which is a big part of why we're doing what we're doing, is even just feeling like you're part of the field, where like where's the space for me and for people who look like me and who that I can really relate to also, like where is that? So
Melanin.
that's right.
So what's a good way to respond when a microaggression does happen?
So that's tricky. I don't think it's one set way. I think it really kind of depends on a couple different things. One, the severity of that micro assault, the micro invalidation, or the micro insult, right? So how offended am I of what just happened? How much do I really care, right? Is this a stranger in the parking lot? Is this a coworker? Is this a family member? Is this a neighbor? And then taking all of that, and so based on how I choose to respond, what is the desired outcome, right? Am I mad? So you call me something, so I'm gonna call you something back, and I don't really care. Do I want to use this as an educational or teachable moment? So if this is a coworker, hey, let me bring you aside. It wasn't really cool, what you said. This is how I felt, and maybe do we need to take this to HR, and maybe we need to do a cultural competency training for our organization if you or other people are having similar experiences. If I react out of emotion, am I feeding into this negative, angry black girl, ghetto, whatever that they think I am anyway? And maybe I will, maybe I won't. Do I really care, right? So I think it really just depends on the situation and what you want to come out of that.
And I really want to highlight, look at everything we just have to go through to even be able to process what is the response that's to have, right? And even within that, if I choose to just express my anger, which I'm entitled to feel,
be able to do that.
it's a human emotion. I still have to waive the consequences of can I even, and it doesn't even have to be blow up rage. I'm talking about just being upset, like just being angry about that. Just the fact that I have to even weigh out my right to have an emotional human response.
Right.
Is this going to cause a scene? The other person is likely going to deny it, right? Because they're not consciously
doing
hopefully consciously doing anything to me. But then what are other people going to say if it brings a manager in and all of this kind of stuff? If this is a family or coworker, if I address it, what happens tomorrow when I come back? Is there now going to be tension between myself and this other person? So there's all this other aftermath, which again plays into the whole psychological damage that when these things occur over and over and over again, how it affects me.
Like I can't even just have my emotions about the situation. Like look at who's responsible, like taking on all this responsibility of what happens next. And I think it's important to note, because you said something, maybe they didn't intentionally do it, right? That's fine, but like if I'm in the parking lot and you pull out and you don't see that I'm standing there and you run over my foot, my foot doesn't hurt any less
because you didn't
mean to run it over. Like if you come out and you say, "Oh my goodness, I ran over your foot. Let me rush you to the hospital." That's gonna at least help me to I can feel. But if you come out and you say, "It was an accident," why are you upset at me? Like I didn't even mean to run it over. Right, but my foot's broke. So can you just own some of that?
So is there even a way to create a space free of microaggressions? Are there?
Ooh, that's a good question.
I think for clinicians is really important for a variety of reasons. One part of therapy is building that therapeutic relationship and rapport, right? So if a person of color chooses to see someone who is white, do I trust that therapist where if I want to talk about race-based things that have happened to me, is this person comfortable in allowing me the space, or are they going to engage in microaggressions of invalidating my feelings? That didn't really happen. You know, I just see you as a person, all of these type of things, right? Because then this is my space to be able to talk about and disclose whatever I want to. If I feel like I can't do that with you, then one, that's going to impact my therapeutic success, right?
Absolutely.
I may not trust you. And also think about, as clinicians, we determine diagnoses, right?
Right.
Especially when people are using insurance. So if a clinician has certain biases and prejudices of people of certain color, again, this is also race, gender, you know, sexual orientation, and religion as well, what does that diagnosis look like? We know that African Americans, especially boys, are diagnosed with ADHD at a higher rate than their counterparts.
Right.
If I say, you know, let's say I had a loved one who passed away, and you ask me, do I see things or hear a voice? And I'm like, yeah, you know, sometimes when I'm sleeping, I see grandma, grandma talks to me. Are you going to ask more questions about my culture? Are you going to ask more questions about my religion and my faith or whatever? Or are you going to be like, hallucinations and delusions, and now you done sent me to the psychiatric hospital.
Right.
You see what I'm saying? And so it definitely, you know, plays a big part in the therapeutic process. So I think for clinicians, one, we need to recognize our own personal biases and prejudices. I would recommend an annual cultural competency training for everyone.
Say it again.
Cultural competency training for everyone.
No matter what your culture is. That's
exactly.
It should be part of your ethics that you have to take on. Like, it must include cultural competence.
Right.
And for larger agencies, I think this is important for the front office staff all the way up to senior leadership.
Yes.
Right? So when clients are coming into the waiting area, how does that receptionist or intake specialist interact with, you know, new clients? If it's the waiting area and there's magazines, you know, do they all look a certain type of way, or does it represent people of different cultural backgrounds?
Right.
And also looking at your staff, is that reflective of the clients or the community that you serve?
Right.
And also the last thing I would say is for white clinicians, you talked about the white privilege. Really think about what it means for you to show up being a white male or white woman in America, right? You didn't ask to be born that way, but I think being able to acknowledge that there are still certain privileges
That comes with it.
Yeah, right. And that people don't always have the fair start in the beginning of life. There's just a lot of other hurdles.
Right. And we recognize, you know, we all have some sort of privilege on some level. Right. There's some, so, you know, being heterosexual, being Christian, being like, there's certain privileges, so we get that, and it's more about checking your privilege, understanding that you're right, you didn't do anything to earn necessarily that privilege, so you can't necessarily be blamed for the privilege. That's not what people are saying. We're just saying recognize that it's there. Not everyone has the same advantages, and so just be curious when a person of color is sharing their experience, if they happen to share with you their experience of like, well, this is how I experience life. It's different, right? I'm not blaming you for it. I'm just saying this is what I experienced. Can you hold space for that? Can you be uncomfortable in me telling you, like, no, it's not like that for
me? But it's also important, I know we're kind of using people of color versus white, but people of color can also engage in microaggressions as well. So there are things that we can do towards other minorities that, you know, maybe
and being able-bodied, right? Like, what are kind of like the privilege that we have being able-bodied? So this is. And we can have our own bias. We've talked about this before, even within our own cultures, have our own biases.
Absolutely.
So, yes.
Yeah.
All right, so we have to start kind of wrapping it up. Conversation. We will be bringing Kamilah back at some point.
Yes.
So what are your favorite resources, books or things like that?
I brought them.
Oh, yes.
With my little notes. So So the first is The Body Keeps the Score. It's really great talking about trauma, how it affects our thoughts, our bodies, and all of that. And then also this one is Risk Management for Social Work. So, I know it says social work, but I would say for all clinicians. So, it talks about confidentiality, our different liabilities, rapport, insurance, all of those kind of things. So, these are mine to
go to.
Awesome.
All right.
Thank
Those
you.
are great.
So tell us a little bit about your practice.
So I am a LSCSW, licensed clinical social worker, and I'm practicing at Sci-Hope Counseling in Cypress, Texas. So the agency sees children as young as 2 years of age all the way up to seniors, providing individual, group, family, and couples counseling, and they also have a speech therapist there as well.
Sweet.
But I see clients ages 13 and up for individual.
Okay.
Yep.
Awesome.
Yeah.
And what are you doing? What makes you a dope therapist?
I am a dope therapist because I have the perspective of being on both sides of the couch. And I think that's really important because I know what it means to have to sit over here and be emotionally vulnerable to a stranger and really kind of dig deep to work on, some personal issues. I'm a dope therapist because I use humor. I love to laugh in sessions. I'm really trying to just normalize things and just focus on the client and really giving them a non-judgmental, down-to-earth space to talk about whatever it is that they want to.
And she's a dope therapist because she's one of the therapists on the Melanin.
Yes, you can find Kamilah on the directory. So we appreciate you. You've been supporting from day one.
Yes.
So we definitely appreciate you. And so what are you doing? What type of work do you feel like you're doing to change therapy or to show that therapy is dope?
Yes, so I am all about mental health trainings to facilitate the conversation, to normalize mental health and mental illness in our community, and also to reduce associated stigma. So I do lots of different workshops across the Houston area to churches, nonprofit organizations, talking about mental health related topics. And then also I change how I introduce and talk about my profession. So before, when people would ask me, what do you do? I would say I'm a social worker. So now I say I'm a therapist. And even just saying that, people are like, what? Really? What kind of therapist? And what does that mean? And it just starts a conversation from, oh, you work with crazy people. Oh, you, but it gives me an avenue to then start educating. And then also say, there are tons of other clinicians of color.
Yes. Love it.
That's so awesome. Woo. So why is therapy dope? This is the last question.
Therapy is dope because it gives you a safe, confidential space, and I say to take the mask off. Because I think we walk around coping and being the best that we can, but sometimes we are struggling with so much on the inside, so it gives you that space to do that where you can be real. Because your friends, your bae, your family members, they may go tell your business.
Right.
But that therapist, is going to stay in that room and you don't have to see them again until your next session.
Yeah. That's awesome.
Yes,
That's
I
so
love
awesome.
it.
Well, we appreciate you
So much. This was so good.
Yeah. So how do they find you across social media?
Yes, so I am on Instagram and Facebook at KBT Counseling. I also have my own website, www.kbtcounseling.com. So you can go to the website to book sessions with me or also mental health training.
Yes,
Awesome.
on it.
All right. Well, that's all we have.
Yeah.
Okay.
Yes.
Go ahead.
Go ahead. No, you go ahead. I know what you was going to say.
I was going to say that's all we have. We have a few announcements for us, but that's all we have to say.
Oh. So I'm so excited. So one of the biggest announcements is we are coordinating and have already confirmed
Some dope people.
dope therapists. So June
3rd.
It's
a Sunday.
It's a Sunday, 2 to 4 p.m. Central Time. You don't even have to leave your house.
Okay.
We are having an online town hall discussion. And the topic is changing the face of therapy. We're going to be talking about the direction of minority mental health. And we've got some really, the lineup is just like, ooh. So we have Dr. Joy of Therapy for Black Girls is going to be one of our panelists. We have Rashawn Miller, who is a mental health advocate.
And just won an award.
Won an award from the American Psychiatric Association is going to be a panelist.
Yes.
Dr. Manuel, who is out in Austin, Chicano psychology. Nice. We have Dr. Nikki Cole, who is also a local professor, therapist over at University of Houston. We have
Dr. Jess.
Yes. Who is an international relationship and sex expert. This is gonna be so good.
It's gonna be good.
And so it's June 3rd, free event. We're gonna have the link in the comments by today. And so be part of it, because you can go ahead and you can ask questions, you can interact with the panelists. We're going to be talking about the direction of minority mental health, how to continue spreading mental health awareness, but also how also can white clinicians be sensitive again to some of these issues that we've been discussing. So it's going to be so good. I'm so excited.
Yeah, so make sure you check that out. Go ahead and sign up. We'll put the Eventbrite up. Like we said, it is a free event, so you can go on and ask questions. We'll do a panel discussion, and then we'll do a Q&A as well. And so it's going to be dope.
I feel like if this was like the like a music type of summit. We got some rock stars.
Okay, I don't know where you're going with this, but okay. I never know where it was. Right. I never know where.
She's always like, Lord, where's she taking me?
Yes.
Like, this is going to be so good.
Check it out. If you have any questions already that are popping up, send it to info@melaninandmentalhealth.com so we can go ahead and start planning that and putting that on the actual program and talk about some of these topics. But yeah, we're excited.
Because it is a town hall discussion.
It is a town hall.
So it's not just going to be us talking at you. We want you to be part of the conversation.
And if you send us questions, we'll ask the question, make sure to shout you out, give you some recognition as well. So make sure that you do that. So yeah, it's going to be awesome. I'm so excited.
Okay. All right. Thank you, Kamilah.
Thank you.
Bye.